Director of Emergency Services. How are you?
I'm doing good. Thank you so much for taking the time to meet with me today.
Problem.
So I just wanted to talk to you a little bit about expanding House Bill 2020. Are you familiar with that?
No.
Okay. Well, what House Bill 2020 is recently passed in this 84th legislative session, and it was designed to give paramedics another avenue to practice outside of an ambulance.
Okay.
So it allows paramedics to work under direct supervision of a physician and under their orders and provide life-saving interventions within a hospital, primarily the emergency department.
That's interesting. I've never heard of that.
Now, do you have paramedics working in the ER?
No, not currently.
No. Okay. Well, I'm an ED nurse, so by just the nature of my work, I know that we're stretched in the EDs. We're working short staff. There's never any nurses, and with the overcrowding and the amount of patients coming in, sometimes it just feels like if I could just have someone that could help me a little bit more than an actual CNA or an ER tech, I feel like I could get more done and provide better care to my patients.
Okay.
And I think that's what supporting the expansion of House Bill 2020 can provide to the emergency departments. So paramedics come with a wealth of knowledge. Their program is very extensive. They focus on critical care skills and knowledge. Most programs are 2 years, and when these paramedics come out into the field, they provide a great care in the most unknown and crazy circumstances, so their adaptability is very, very good. So with House Bill 2020, our proposal is that paramedics can work side by side with ED nurses and provide a team for delivering the best patient care. So currently, less than 20% of paramedics work in a hospital, and of that 20%, less than 10% are actually practicing to the top of their license. Okay. So as compared to having nurses, aides, or techs in the emergency department that could only do things like basic ADLs of care, the goal would be that these paramedics could use their skills, start IVs, start IV fluids, really to create more of a team approach so that the nurse, the RN, can focus on discharge teaching, assessment, and things like that we're kind of lacking right now in our emergency departments. Yeah.
Are EMTs qualified to give meds? Or?
Yes, their program allows some basic medications. Okay. They actually offer a wide range of medications, of course those ACLS drugs as well, but it's kind of up to the facility. We would adapt the bill to where the facility could choose what kind of medications they want to give, as long as it's in their initial scope. So in our vision, the new ER team for the patient would include the ER physician, the RN, the CNA, and then the paramedic. So that would be the new ER team. Now, the Emergency Nurses Association has not been very supportive of this, and I think their fear has been that paramedics would replace nurses. We know that that's not true. We know that's not the case. That you need nurses to do some of those more holistic approaches and that teaching that the paramedics don't offer. But I think that when you go to the directors, and I once was a director myself, so I feel your pain when you don't have nurses, or you go to the staff nurse, if they knew they had somebody like a paramedic, they would feel so much more comfortable knowing that that additional person has advanced knowledge and critical thinking and triage abilities to know when something's going wrong with their other patients.
I don't want my nurses overworked.
Oh yeah, no. And they can focus on the lower acuity patients if they need be, the more clinic-like stuff, so that the nurses can, take care of that septic patient or that STEMI that's coming through the door. So right now we're really just trying to push in the knowledge and the awareness of House Bill 2020. So just here's a quick brief on it. Read up on it, my email, my phone number, call me anytime, share it with your nurses, get more information. But we're really looking for some support right now on House Bill 2020. So.
Thank you.
Thanks, Julia. It was so nice meeting you.
Nice meeting you.
Bye.